About 6 years ago, a 10-year-old boy, Jack, came to our clinic for mental health evaluation. Jack was accompanied by his soccer teacher and parents. This cute-looking boy appeared awfully terrified, looking around nervously, but avoiding eye contact with me. Jack was sitting in a chair with his body rocking back and forth, and his leg shaking. If you ask him a question, he only answers questions with a nodding or shaking his head. He has been to many doctors and tried multiple medications, only got worse. What exactly was wrong with Jack? Why is that so many medications are not working? Can we help him? These are the questions of his parents and the topic we're going to discuss today. This is Dr. Young's Health Talk. Health is our number one asset. Let's manage it well. So how did the boy's condition get to this point? According to his parents, Jack was about 9 years old when he was watching a TV show in which there was a horrifying scene. Suddenly, this horrifying scene turned into an idea that this scary scene would happen to his parents. These intrusive thoughts appeared in his mind constantly. What kind of TV image is this? And what kind of thought did it generate? We still don't know today. The image and the thoughts must be too horrifying to describe. To this day, Jack won't even tell anyone, including me. The recurring uncontrollable intrusive images and thoughts caused Jack tremendous amount of fear and anxiety, preventing him from focusing on his studies. He was fidgety, could not perform normally even though he was a pretty good soccer player. He couldn't sleep at night, feeling groggy and miserable during the day. Jack's parents took him to several pediatricians and child-adolescent psychiatrists who diagnosed him with obsessive-compulsive disorder and ADHD based on his clinical presentation. They treated him with psychotherapy and medications. Unfortunately, the psychotherapy had little effects on him because Jack was too anxious to focus on and following the conversation with the therapist. The medications were even more problematic for Jack. They did not work for him, but it gave him lots of side effects. Medications made him irritable and even suicidal. Jack's problems were getting worse. His parents couldn't do anything about it, and the doctors didn't know how to help him anymore. Coincidentally, his soccer coach, who has back and leg pain, was having acupuncture treatment at our clinic, so he referred this child to us. In fact, this is a typical scenario that most of our patients do not come to us at the beginning of their illness until other treatments have failed them. We are the last straw and a ray of hope, so there's a lot of pressure on both sides. So what would we do differently to help him? First, we would evaluate his symptoms to make an appropriate diagnosis and see how severe his symptoms are, which is the same as any good psychiatrist would do. He indeed has symptoms consistent with OCD and ADHD, but he also has symptoms of chronic post-traumatic stress syndrome. As a result, Jack also has severe anxiety, insomnia, nightmares, and depression. But giving him a diagnosis does not solve the problems. The diagnosis only describes the outcome of disease, but not the cause of it. Suppose you complain of chest pain, shortness of breath. In that case, your doctor should at least be giving you an electrocardiogram to check electrophysiological activities of your heart. We did the same. We used the most advanced analysis software to quantify Jack's EEG activities and showed it in 3 dimensions. I will show you the changes in the EEG before and after 2 years of treatment at the end of this video. Jack's quantitative EEG showed an increased high frequency of brain waves in his prefrontal, parietal, and temporal lobes, which were consistent with the clinical symptoms. He also had a problem with hyperexcitability in the limbic system that mediate emotional and physical function. Jack has no idea or control over these problems in his brain. Is just trying his best to cope with them and survive in every way he knows how. Of course, it is all mystery to the parents as well. They don't know why this child was acting that way. Parents and doctors are just trying to control and change his behavior, which again are the results of the problems, not the cause of it. So as a side note, we should not easily reason with people with emotional and behavioral disorders as if they can control themselves. The more you do this, the more they feel that you don't understand them, and the more frustrated they will feel because you're asking them to do something they cannot do. The good thing is that the brain is an organ that can change, called neuroplasticity, especially in children. But for most of us, the brain never has the opportunity to look in the mirror to see what is wrong. If the brain sees the problem, it can help change it. All we need to do is to provide the brain with that opportunity. That's the neurofeedback therapy. Jack likes the neurofeedback therapy because he doesn't have to do anything, just sitting there and quietly watch the movie he picks from the Netflix. When his brain activity is not optimal, the TV screen connected to the computer becomes dim, which sends a signal to the brain with a sound. The brain will just normalize and TV screen becomes clear again. As the process continues repetitively, the brain's activity will become more and more regular. Is neurofeedback therapy enough for helping Jack? No. The brain is not only an energetic powerhouse, but also a vast chemical factory. How is Jack's biochemistry contributing to his problems? Jack has a little known but common biochemical imbalance among mentally ill called Pyrrole disorder. Pyrrole is mostly a metabolite of the body's red blood cell, which is useless and harmless to the body and leaves the body through urine. It only becomes problematic when the body produces abnormally high amount of Pyrrole, because Pyrrole binds strongly to vitamin B6 and the mineral zinc, which takes these essential nutrients away. Usually, Pyrrole in the urine should be less than 60 micrograms per cubic liter, but Jack had 92. Jack received advanced nutrient therapy to reduce his body's oxidative stress, replenish his body's lack of vitamin B6 and zinc, and balance his body's essential fatty acids. Jack's symptoms dramatically improved within the first 3 months, and he resumed regular schooling within 6 months. His symptoms were resolved completely after a year. It has been 6 years, and the cute little boy has become a handsome young man. He benefits greatly from psychotherapy now and begins to explore his spirituality. Here's a Jack's brain map before and after treatment I promised to show you. The change and the improvement are enormous. We have many real cases like this to tell. If you'd like to see more videos like this, leave a like and subscribe to the channel. Thank you for watching our program, and feel free to share your experience and questions in the comments. Dr. Yang's Health Talk. See you next time.